Hello, my name is Tanya, and my presentation is on psychology and nursing, how psychological concepts bleed into the nursing fields. As a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients. They may forget our names, but they will never forget how you made them feel. Maya Angelou. Nursing is a healthcare profession with a focus on the promotion of health through patient care and the prevention of illness, as well as advocacy for the patients, families, and communities in collaboration with physicians and other healthcare professionals. Stress, lifestyle, and health. Nurses play an important role in promoting stress management and health lifestyle choices for patients. Stress and illness. In Chapter 14, Stress, Lifestyle, and Health, we learn that stress is a response to overwhelming or threatening events that may look different for each individual experiencing it. For example, someone who is not immersed in sports may not feel the same pressure or stress while watching a football game as a loyal fan dedicated to following their team throughout a whole season would be, given that they stay on top of every detail and test the patient for their team's outcome. Responses to stressors can be psychological, cognitive, and behavioral. The damage that stress can have on the body are not only mental but physical as well, as stated in The Impact of Stress on Body Function, a review. It is now obvious that stress can cause structural changes in the brain with long-term effects on the nervous system. This unfortunately promotes weakened immune systems, leading to further complications at many times prolonging hospital stays. Regulation of stress. Stress is not just a physical response, but also a mindset. When you change the way you think about stress, you can change how it affects you. The negative health implications connected to chronic stress are numerous, which is why finding healthy ways of coping or dealing with said stressors are important to bettering one's health. Nurses can help by educating patients on breathing exercises, meditation, and promoting exercise and good sleeping habits. Nurses are the patient's advocate while under their care, and something as simple as breathing techniques can assist the patient in regulating the increased stress of being hospitalized. The feeling of not having control over one's health or outcome is also a great stressor in these situations. Albert Bandura, 1997, stated that the intensity and chronicity of human stress is governed largely by perceived control over the demands of one's life. A healthcare provider can allow the patient to have perceived control. When it comes to decision making, they assist in informing the patient that they always have options in their care, which in turn betters their health outcome. People who report higher levels of perceived control view their health as controllable, thereby making it more likely that they will better manage their health and engage in behaviors conducive to good health. Nurses help create a safe space in which patients can express their concerns and anxieties, which in most instances help alleviate some stress from the patient and or families, as well as providing comfort and reassurance during stressful moments like intense treatments or when receiving a diagnosis, hopefully helping to relieve some emotional burden from the patient. Lifespan development. In nursing, being able to understand lifespan development helps equip them with the skills needed to meet the diverse needs a patient has throughout their lives. It is essential for nurses to be able to provide the appropriate care for each patient at each stage of their life. Stages of development. In Chapter 9, we learn that development is the change that occurs in 3 different forms throughout life: physical, cognitive, and psychosocial. The first, physical, encompasses the brain and body, i.e., personal physical growth, the five senses, and how they play an important role in the way we experience the world. Motor skills, how we move and use different muscle groups. In cognitive development, it focuses on the child's thinking patterns and their understanding of the world. Psychosocial stages of development consist of 8 stages, all with a specific conflict or challenge. The resolution of these challenges indicates a healthy psychological, and emotional outcome for the individual. Death and dying. Nurses play a vital role in supporting patients and families during a difficult process of death and dying. In hospice care facilities, the goal of healthcare workers is to provide the patient the dignity and comfort needed to transition into death. In an out-of-patient hospital setting, the patient and their family are allowed to feel more at ease with the terminal diagnosis, with all-around care aimed to help and pain management and counseling for not only the hospice patient but the family members as well, given that as a caretaker they need support as well. Apart from providing medical care, nurses also have a key role in emotional support, being that they are in constant contact with patients. Nurses are not only advocates for their patients' rights and dignities in their death, but a professional there for their every need to ease any uncomfort or doubt. Post-death care. After the patient has been pronounced dead, nurses have an important responsibility in both the hospital or hospice setting. Apart from usually being the first to recognize when patient death actually occurs, they are often the ones to pronounce death and responsible for preparing and positioning the body. Nurses are most often the first immediate support to families. They are in charge of offering families information about grief counseling and helping with the next steps, such as where to contact funeral services and finalizing the necessary paperwork for the death certificate. These are the references, and thank you very much.